Hi, Michael Bloom, chiropractor. Heaps of people suffer from groin pain or hip pain. And what I also find in practice is when people arrive with hip or groin pain, they've commonly undergone forms of x-rays or MRIs or CT scans. And commonly they are told that they have got some form of a tear around the hip joint. Often it's called a labrum tear. So the assumption when you know that that's what's coming up on the MRI or the CT is that must be causing all the pain I feel around the hip and the groin. But what's interesting is that in many cases, these people with the tears are also being advised by their specialists that the pain they're feeling isn't necessarily from the tear. I'm here to tell you about one of the most common causes of the hip or the groin pain because it's not actually the hip or the groin. It's known as the sacroiliac joint, or the joint just at the back here. This is the left, this is the right. The sacrum's there, the ilium is here. This joint commonly becomes dysfunctional, which means it doesn't move and hinge the way it should, and it creates a change in the way the nerves are distributing information across the joint. And one of the most common referral points from this joint is straight around to the front, around the groin and the hip. So you can see how it becomes so easy to confuse hip pain, especially if you've had an MRI to show that there's some degree of a problem with the hip, and assume that it's all from the hip. But in so many cases, it's either partially the hip and partially the sacroiliac joint, or actually the hip itself's not actually causing this groin and hip pain, and it's the sacroiliac joint. I hesitate to say that this is the most common area that I work on in my entire practice, would be that joint. It is so common to be problematic. So if you are suffering with some hip or groin pain, you're not quite sure what's going on and you're going through a myriad of tests and seeing different people, perhaps get your spine checked out by someone who really knows what they're looking for and feeling for, and determine if you have sacroiliac joint subluxation or sacroiliac joint dysfunction that you need to have corrected to give yourself a chance to feel and function properly again. So I hope this information has been useful to you, and wherever you are, have a great day.